My name is Josh Houry, and I am the communications coordinator here for the Saskatchewan SPCA. We want to thank you for being here this morning for our webinar series called Difficult Decisions When Navigating the Journey. I always feel that it's important to start by acknowledging the fact that I am on Treaty 4 territory. I live and work on Treaty 4 territory, as well as the traditional homeland of the Métis as well. I want to acknowledge and pay my respects to the ancestors of this land that we now call Saskatchewan. And I also want to I guess, issue a bit of a warning, as this webinar does discuss the topic of euthanasia. And so we do encourage you to take the appropriate measures to ensure that you are able to take care of yourself should this topic become distressing for you. So please do keep that in mind. We will not be offended at all if you need to step away and just take care of yourself, because that is very important to do. In today's webinar, Dr. Elizabeth Andrew will share invaluable insights into recognizing when it's time to consider euthanasia and provide practical advice on making informed choices that prioritize your pet's comfort and well-being. Dr. Liz is a veterinarian certified in animal hospice and palliative care. She operates Sunset Veterinary Care, exclusively offering in-home end-of-life and euthanasia visits. It's a first-of-its-kind service in Winnipeg. Dr. Liz was inspired to start her house call service following the death of her cat, Tiger. She chooses to honor her dog, Jack, who passed in December 2023, by continuing to offer this meaningful service. She is passionate about maintaining the human-animal bond and providing peaceful endings for pets. She is a graduate of the Western College of Veterinary Medicine at the University of Saskatchewan, and she currently lives in Winnipeg with her husband, two young sons, and their two dogs, Hot Rod and Rigby. Dr. Liz, thank you for being here today, and I turn things over to you.
Thank you, Josh.
Sorry, I forgot to mention one
yeah.
thing. Questions are allowed.
Yes,
And
yeah.
if you do have any questions, we encourage you to pop them in the chat, or you can use the Q&A feature at the bottom of your screen, and we will get those questions to Dr. Liz throughout the presentation. So my apologies for interrupting, and now it
No
is
worries.
officially yours.
Thank you, Josh. So before I share my screen, I also wanted to take Josh's lead here and also just acknowledge that I am on a different treaty territory, that I'm on Treaty 1 territory, which is the land of the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and is the homeland of Métis Nation. As well, just because of some of the names that I've seen in here, I wanted to just share what's sitting on my desk here. I just have these cute little crocheted versions of my dogs from Sydney Chow. So thank you, Sydney, so much for being here. And Dr. Wheeler as well, that you're familiar with Jack as well. So, okay, so give me a second while we just share our screen here. So it's so nice to see some familiar names. Okay. As long as I don't hear that you cannot see what I have here, I will assume that you can see it.
Everything looks good on my end.
Thank you so much. Okay. So today, as you're aware, that we will be talking about end-of-life decision-making for companion animals. And thank you so much to the Saskatchewan SPCA for inviting me to be here with you guys today, because Saskatchewan is a province that I lived in for 4 years and during my veterinary school. So I do care a lot about Saskatchewan just as much as I care about my own province in Manitoba. So just a little about me slide. So thank you so much, Josh. You did a good job kind of summarizing things, but that's me and my three dogs, Jack, Hot Rod, and Rigby. Sadly, Jack passed away through euthanasia last December at the age of 14 and a bit. And then my little guys are both 14 right now. As well, you can see my contact information here, that you can find me on Instagram or send me an email if you need to. So for some of our goals here today, I'm hoping that today will be kind of a bit of a um, practical overview of how we can um, kind of assess quality of life for pets. I know that there's going to be a bit of a range of people that are here today. So first one that I have for our goals is kind of how is animal welfare going to be intertwined with quality of life? Um, how can we measure quality of life? And for me, one of my biggest measurements for quality of life is pain. So what does pain look like in cats and dogs? So I thought to kind of bring everything together that it might make sense if we talk a little bit about the five freedoms, because this is such a big part of animal welfare is kind of relying on these five freedoms. So to just go over those, that's the freedom from thirst, hunger, and malnutrition, the freedom from discomfort and exposure, the freedom from pain, injury, and disease, the freedom from fear and distress, and the freedom to express normal behavior. As well, while I was kind of going through everything to put together this webinar, I came across this paper from 2016 that kind of challenged the five freedom model. I don't want to go into too much detail about it for the purpose of this webinar, but I just thought that it might be kind of worth noting that they're basically suggesting that maybe the five freedoms are subject to being interpreted as absolute, so that animals must be 100% free from everything. So 100% free from pain, 100% free from hunger. But we kind of know that just with biology and behaviors, there's a lot more things that make it complex, that maybe having some of those negative things are warranted. Some of the things are required for survival. So for instance, if an animal never feels hungry, is it going to seek out food? If it never feels pain, how will it learn to avoid situations that cause pain? As well, kind of this thought that if we remove all negative affects, is there any sort of guarantee that we are going to have anything other than a neutral state? So that just because everything is not negative doesn't mean that it's positive. And then also kind of this surviving versus thriving idea. So is the animal just alive, or are they enjoying their life? So just because we're free from all of these things, does that mean that it's a life worth living? And then finally, kind of coming to this idea that quality of life is a spectrum. So a lot of what I do during end of life decision making with companion animals is really focusing on measuring or considering what the quality of life of that animal is. So brings us right to what the majority of today will be. So I wanted to just kind of course, say that quality of life in companion animals is pretty subjective, complex, and broad. So just kind of trying to summarize it for simplicity here today, that the definition from the dictionary is going to be the degree to which an individual is healthy, comfortable, and able to participate in or enjoy life events. And then, of course, kind of bringing the welfare aspect back into things, how do the different parts of measuring quality of life fit in with the five freedoms or into the a life worth living model? So I think we're mostly going to kind of put it under the five freedoms idea just for simplicity's sake, but kind of thinking about how this life worth living kind of ties into everything as well. And then, of course, as I mentioned earlier, that it is pretty subjective, but we can be a little bit more objective about how we can interpret things to just help with these decision making. Okay, so you'll see these letters QOL. That's just me shortening down quality of life instead of typing it over and over again. So QOL is going to indicate quality of life throughout my slides. As mentioned, this is going to be recorded and on YouTube later, so feel free to watch back, screenshot, or email me if you have any questions about the content of anything that I'm happy to share. So quality of life scales, I guess I won't I won't spend all my time checking the chat, but if anyone wants to share if they're familiar with you've seen any scales or have used any or anything like that, I would love to hear about any experience anyone has. But essentially the idea is that we are going to be trying to make something, like I said, that's so subjective, a little bit more objective. So we're going to be looking at different kind of elements and kind of focusing mostly on the patient, but we want to also consider the caregiver's quality of life that I'll touch on in a little bit here. And that this is going to be to make it a little bit less subjective. I think it's most important to try to determine which parts are going to be the most important to a pet. So for instance, obviously, hunger, or, the appetite level is going to be a more important part of quality of life for a really food-driven animal. But if it's a pet that's usually always been picky, that might not be as important to their quality of life, how well they're eating. And then on the flip side, maybe a pet that's really playful, their level or interest in play is going to be a more important parameter to be checking versus a pet that's always been maybe a bit lazy or not interested in interacting with other people. So I find these scales are really useful, of course, for helping determine if euthanasia is a valid decision, but they can also be good for adjusting treatment plans. So if there's a pet that's undergoing a big diagnosis and now more treatments that we can help, it will help us determine if that treatment is actually effective or not by looking back and kind of tracking numbers and things like that. But it is, of course, important to remember that this is a tool and not the only thing that is going to make a yes or no decision. So there are several different quality of life scales that are available, but I have found that each of them have some pretty common parameters or categories that are covered when we're assessing quality of life. So to outline some of the major ones, and then we'll maybe go through some examples of the different scales that are available. And then I also want to kind of just note where these kind of fit back in with the 5 freedoms. So one of the major categories is going to be activity. So this is, noting on their level of play, their movement or mobility. And then this, of course, then goes back to the freedom from pain or injury or discomfort. We'll also look at the behavior of the animal. So this is going to be parameters that are focusing on their interactions, their sleeping, their enjoyment of life, any changes noted in their behavior, things like hiding or their activity at night. This, of course, is going to be allowing that freedom to express normal behavior, but also freedom from discomfort or distress or pain. The third one here is pain. So things like obvious pain, also noting things like panting or trembling. And of course, the very obvious thing is that this is the freedom from pain. As far as the more physical symptoms that we might be checking, so things like gastrointestinal upset, so things like vomiting or diarrhea. Are there any weight changes, changes to their urination or defecation? How about their overall appearance, their hydration level? And of course, this is tying into things like the freedom of disease, freedom from injury or pain. And then finally on this page, I have appetite and thirst. So are there any increases or decreases? Because both can be indications of signs of quality of life. So the last 8 that I want to cover here are autonomy. So this is, of course, that sense of self. So things like, are they requiring assistance for movement? Are they soiling? Do they seem confused? What is their what kind of status of their mental health? And of course, this is tying in again with the freedom to express normal behavior, freedom from discomfort or fear, distress. And then favorite things. So are they still engaging with their favorite things, activities, or people? And of course, this is tying again into that freedom to express normal behavior. So you can see that a lot of these things that I talked about do cover the different 5 freedoms and tie in. But one of the last things that I like to cover is the caregiver quality. So what is their desire and ability to help out their pet? What have their past experiences been? Do they have any concerns for their well-being of themselves or their other family members? Yes, Josh, I see you here.
Yes, so this actually, I think, might tie in with a question that came
Mhm.
in. And so the question is, will dementia and cognitive decline be discussed today? Now, I'm not sure if they're talking about from a pet perspective or the caregiver
Yeah,
perspective, but I guess I will present the question to you and then maybe they
yeah.
can follow up with additional questions.
So I'm not going to be talking about maybe any one specific disease. It's more kind of everything as a whole, how we're going to be checking things. But it is a very that is sadly a really big issue that can come up with pets at the end of their lives. And I would say while I'm not, like I said, specifically talking about any one disease or disorder, that you'll see that things that kind of tie in a little bit with cognitive dysfunction in senior pets will be kind of fit into some of these parameters that we would check. So when I'm talking about the caregiver quality of life, of course, they're not my main concern. But I'm not saying this in a way that I will be maybe more lenient and allow a pet to suffer because somebody wants that to happen, but more so, how can we kind of take into consideration, like I said, their desire or their ability to provide care. So a couple of examples that I have here. So for instance, if there's a client that is 80 years old and has arthritis, but her dog is 100 pounds, she's not going to be able to care for a 25-pound dog the way that an able-bodied 20-something person would be able to. So we have to take that into consideration. Also, if there's a family that's experienced a traumatic or emergent death of a pet, there may be less likely to want to wait for further decline and may choose euthanasia a bit sooner when there may be still some good days, so that they don't have to go through that same experience. So it's all part of the conversation, either with between a veterinarian or veterinary team and a client, or just within a family to have these discussions, or with yourself to have these discussions for what's important. Okay, so here are a couple of examples of different scales that I recommend. So this one is one of the first scales that we'll just call it because it's a lot of letters to say out in a row. But this is one of the first quality of life scales that was developed and widely distributed. So Dr. Alice Villalobos is a pioneer in pet hospice. So she's actually a pet oncologist. And sadly, dealing with pets that have cancer often comes with outcomes where their quality of life can diminish and families may be choosing euthanasia. So this was kind of created, she kind of created this out of necessity to help her patients and the families that she helps. It's a pretty simple version that it relies on kind of the subjective decision of you saying like, oh, I'm going to give this a 1 to 10, right? So you're kind of deciding on your own. And you can see that some of them are, the letters go with each of the different parameters. So, how painful do we think our pet is? How clean are they? How happy are they? How good is their mobility? And like I said, that's kind of relying on us as pet families, not veterinary teams being the ones to decide where some of those things might fit. And we don't always know. But the good news is that it does give a number, and that's something that you can track. The Ohio State University has a really wonderful resource page. I tried on everything to put the websites here. So again, feel free to take screenshots. Yeah, it's over here too, the full link. But this is a document that has a few pages. Starts a little bit more with some tips of how will I know when it's time, and having some questions and resources to go through. And they've recently updated it to actually have numbers, because before it was just lines and you kind of put marks along the pages for where you thought your pet might fall. But now I find that this one is a little bit more helpful because it does give numbers. But anywhere from my pet does not want to play, my pet is hiding, my pet is trembling or shaking, losing weight, just some different factors that might come in as we kind of went over earlier, those different things. So this is my personal choice for going over quality of life with pets and families. So the Lap of Love is a big service that covers most of the US. They have vets in, I think, almost every state. And they are an in-home euthanasia and hospice provider. But because of just their size, they have quite a few resources available to them. You can go onto their website, lapoflove.com, and under the quality of life, it will guide you to this where you can actually enter some information and it will help you out with some questions, or you can just click here. It says download a printable copy, which is what I have on our next slide. And this is the one that I really like. So this is really a yes, no, maybe, which I think yes, no, maybe is a lot easier for people to kind of pick, instead of sometimes the 1 to 5 is a little bit trickier, but or a 1 to 10, but a yes, no, maybe is a little bit easier. And then when you total all the score up, it gives you kind of 3 options of things are okay, things are questionable, things are concerning. And then with a little bit more wording of how you should approach things. But generally speaking, saying to speak with your vet. So if you're chatting with us today from the vet side, then these are going to be really nice tools to share with families that you're helping. But if you're joining from that you're an animal lover, then these might be more helpful for you to look through, and then just have some talking points to bring to your vet about what your concerns are. The reason I really like this one is because of this second page that goes over family concerns. So I don't necessarily score it in the same way, but I just think they're important things to kind of just have talking points. So things like, we're concerned about our pet dying alone, that's really important to know, because if you're concerned about, leaving the house and coming back and your pet has passed, then it's going to be important to understand what kind of progression of disease your pet is experiencing, so that you know what to look for before they might be in some sort of distress. But also if you have concerns about yourself or any other members of your family with coping with loss, that you can start to reach out for those resources or have them ready before approaching your pet's end of life. Oh, and I'll just also note, then it does also have some really good questions here. So, thinking about if you've been through pet loss before, what you're kind of hoping the end of life experience will be for your pet, so that you can do some more planning. Um, and then kind of the last example of a way to measure quality of life is going to be looking at journaling. So this is just really kind of the idea of, maybe doing like a paper calendar or journal, or using the notes on your phone or in the calendar so that you can kind of look at things. Um, it allows you to kind of make it as simple or as in depth as you want. So for some families, I'll suggest kind of drawing a smiley face or a frowny face on the calendar based on how their day was, that you can kind of look back and see, oh, we're getting a lot more frowny faces, that we're having a bit more of a struggle, that we need to consider that these good days are getting outnumbered. But also, if you want to be more in depth, you can kind of note the length of time that different symptoms or how long things have been worsening. As far as when we want to use these scales, so I recommend for any kind of healthy senior pet that it's not a bad idea to give a baseline. Um, if you go through one of these scales and you kind of just are like, everything is fine, but maybe there's a couple things that are a little bit that you start to notice, that it can be just helpful to know what they're kind of like as a healthy senior pet. So of course, there's going to be some changes as they're aging, but to have a bit of an idea will be really helpful to look back to. I wouldn't recommend maybe more than once or twice a year if they're otherwise healthy. We should also be looking at quality of life in our pets after a serious diagnosis. So if we're unsure about when to make a decision to euthanize, or if treatments are still effective, or even if we want to choose to pursue different treatments, that it will give us an idea if the treatments are actually, starting to become more negative than positive for our pets, by kind of tracking these. So again, as I mentioned, most of these have some sort of numerical or kind of visual value that you can kind of see where they're sitting on, that I find that it's really helpful to be able to look back and track things. So we're really kind of trending those values and wanting to move past we want to make sure that we're not going neutral is one thing. We want them to be enjoying, but if we're starting to slide where they're no longer enjoying their life.
We have a question here, and the
Mhm.
question is, do you have any specific communication strategies when using these quality of life scales with clients who are can't even say the word,
Yeah,
vehemently
I
denied,
know what you mean.
vehemently opposed to euthanasia?
Yeah, so I think that would become a more challenging situation when families are really against euthanasia. So, of course, if someone is against euthanasia for either ethical or personal or religious reasons, that uh, that in itself is, I want to say, okay to have those views. But what's not okay is to allow a pet to suffer um, because we're not euthanizing. So we have to make sure that they are going to be very informed about what natural death would look like, as well as the death part itself is not going to be painful, but the leading up to death and experiencing whatever disease process or aging could be very painful for them. So having these different tools to show them that their quality of life is diminishing, or that their pain, that I'll touch on here shortly, is high, that being able to show them that it's not okay um, to allow their pet to be painful just because of their personal views. Um, and then I think as far as approaching it, like, kindness always goes a long way. So approaching it with interest and trying to find out where they're coming from does make a big difference. Because you know, as someone, even as someone that is certified in hospice care, I still am more personally a believer in euthanasia, and that is my personal preference. But if I have a family that can, you know, kind of articulate to me and tell me why they have a feeling of one way, that I might be a bit more understanding than just someone that I may be prejudging why they don't want to proceed with euthanasia. But of course, if we are concerned about the welfare of a pet, then that is where being able to reach out to, well, you know, animal welfare um, organizations is going to be possibly in our best interest, or finding a veterinarian that is close to you geographically, or even just to be able to reach out to consult with about having like a hospice type death. So without getting too political on things, but the way that humans die is typically through a hospice based model. So for a lot of people, with their pets passing, that may be the only way that they have experienced seeing death, is the way that a human would pass. So I would suggest that kind of just making those parallels so that people understand, and then also being able to provide either a referral to a veterinarian that can support that pet in a hospice supported death, or being able to get more information from them to share with your own clients. Okay, sorry here. So again, just as far as the frequency, it really is going to depend what's going on. So as I mentioned, with like a overall healthy senior dog or cat, I would say that we're maybe suggesting to look into this a couple times in a year. But if they have a serious diagnosis, and if you do know a specific kind of life expectancy that's been given, then I kind of take whatever that expectancy is and change that into how frequent we should be doing these scales. So if someone tells me their pet has a disease like chronic kidney disease, then I'm probably suggesting monthly checks to maybe every 2-week checks. If there's a more significant cancer diagnosis and they've been given a couple of months diagnosis, then I'll be suggesting every week or two. And if they've been told that their pet really only has a few weeks to live, that I will be suggesting that this is done probably daily, maybe every other day, so that they can make sure they check and note anything if it changes quickly. Again, because we're trying to trend things, that keeping those numbers and looking from each time. And because I know there's kind of a mixture of people that would be here today, the vet professionals, I would tell you to recommend these scales to all senior pets, patients that are receiving serious diagnoses, patients that are undergoing intensive treatments or not. Even if they get a serious diagnosis but choose not to do treatment, that it's a good idea to start these off as soon as you have that information. For the folks that are here more from the welfare side of things, I would say that these can be helpful tools if you're doing any sort of welfare check or assessment. And I know a lot of them are going to be a bit more geared to the direct caregiver, kind of walking through them and assessing things. But if you're doing any sort of home visit or having a discussion with the owner of the animal, that a lot of these things might be kind of clued into you as far as if there's been any changes to all those parameters that we've talked about, like behaviors, pain level, hunger, thirst, those sorts of things. And then for the kind of above average pet owner, so I know that that if you're spending a Wednesday morning learning about pet quality of life, you're probably above average when it comes to a pet owner. That I would say the same advice to you that I would with the vet teams, that kind of whenever you have any, I guess, really any concerns with your pet's well-being, or if they are aging, that it's good to just kind of start with these and then be able to bring them into your vet team to ask about what your concerns are that come up. Oh, and then pain is probably the biggest part of quality of life in my opinion. That as you saw, that there are a lot of other factors that go in, but I think pain is one of those things that we can make the biggest impact on. That there are lots of options for treating pain, that when we treat pain, that a lot of those other factors that maybe are starting to change, as far as things like their behaviors or their interactions, things like that, will improve when their pain is addressed. So I'm not going to be getting into all science part of pain, but more so how can we identify pain, and knowing that that's kind of the major factor here. So again, going to a dictionary definition. So this is going to be the localized or generalized unpleasant bodily sensation or complex of sensations that cause mild to severe physical discomfort and emotional distress, and typically result from injury or disease, and can be mental or emotional distress or suffering. And again, a sensation that's induced by a noxious stimulus, received by nerve endings, right? I'm not going to go, like I said, into too much of all the science, but that, there is a definition for pain. So when the International Veterinary Academy of Pain Management, IVAPM, kind of has applied it to animals, they're coming more to say pain comes in many forms. Surgical pain, arthritic, and cancer-related pain are just a few to name. Acute pain is going to be the obvious and distressing pain, where chronic pain is going to be more subtle and masked as getting old or slowing down. But to know that old age is not a disease, but pain is. And then there are many options to treat the various causes of pain in animals, including pain medications, physical rehab, acupuncture, laser therapy, and therapeutic massage. So for pain, what are some of those common signs of pain? So again, this is from IVAPM. Decreased activity is the number 1 sign that families will notice. So this is going to be, is your animal not playing as much as usual? Number 2, are they going up and down stairs? So this, of course, could be an earlier sign of arthritis. This is especially applying to cats, but the reluctance to jump onto surfaces, or the difficulty standing after lying down with large or even small dogs. Decreased appetite. This could, of course, be a sign of mouth pain. And then finally, over grooming or licking a particular area. So this is often a sign of referred pain. So where they are licking or over grooming doesn't necessarily mean that is the area where they are painful. So again, these are kind of our 5 most common signs of pain in companion animals. Okay, and then measuring pain. So just with the purpose of this webinar, I'm focusing mostly on chronic pain. So this is going to be standing, that kind of more continuous pain that's going to be coming from things like cancer, organ failure, or arthritis. And then again, thinking of acute pain as more of broken bones, stubbed toes, or surgery recovery. So the feline grimace scale, although I think technically is considered an acute pain measurement, I think that a lot of these are really, I see a lot with chronic pain in cats. So I still hold this as a kind of a chronic pain scale. That this has been developed in Montreal with client-owned cats. And it has been validated scientifically. It's somewhat new, maybe about 5 or 6 years ago is when it officially came out. And then we're looking at 5 different facial expressions or indicators to help us decide what level of pain. And then based on what number we get, whether or not they should receive intervention. So the idea with this scale was that it would be used for cats post-surgery to be able to assess them in hospital for whether or not their pain was being handled. But I think it gives a really good visual for cat families to be able to see what are some of these changes that their cat might be showing that could indicate that they're in pain. So here are the 5 different parameters we're checking. So ear position, and they've got this nice kind of cartoon version, but also a photo version so that you can kind of compare. So of course, kind of more upright versus flattened out. Muzzle tension, so that's the kind of looking at their face for how tight they're holding it. You kind of get the impression of just almost how their mouths are being held and how their little muzzle looks. Head position, so this could vary, of course, if they're sitting or lying down, but just essentially kind of how low are they compared to the rest of their body, or are they tilting themselves? So again, comfortable, a bit uncomfortable, starting to show some more pain, or a significant amount, depending on all the parameters here. And then orbital tightening. So this is around the eye. So how kind of open are they, right? So if there's a cat that's sitting there with their eyes quite closed, and I forgot to mention from the previous page, but this is going to be over 30 seconds you want to observe them. And then finally, the whisker changes. So how are they kind of holding them? So nice kind of droopy, fluffed out whiskers versus they're just kind of being held really tight. So they're kind of just really straight and maybe even angled a bit more forward. I think I have on the previous page, but maybe not. But if you Google feline grimace scale, it will pull up their website. This is, I think, the PDF of it. I have the link at the bottom, but on their website, you can practice how to check these different parameters. And then you can, of course, have these as an option to go through yourself to look at the cat that's in front of you, whether it's your own cat or a patient or a concern for a pet that you're looking at for welfare needs. And then the last thing I'm going to touch on is the BEEP chronic pain scale. So this was developed by Dr. Shay Cox, who is a hospice veterinarian originally from Canada. As far as I'm aware, this is the only truly kind of chronic pain scale. Oh, and actually one last thing I want to just say about the feline grimace scale is that there are grimace scales that have apparently been made for many other species, but dogs are really hard to do because of just how different the conformation of different faces can be. That there's some longer nose, shorter noses, that it's been a bit more of a challenge to consistently show the feline grimace or a canine grimace scale.
There's actually a question that has come
Yeah.
in relation to the feline grimace scale, and
Mhm.
they're actually wondering if you have used any of the feline grimace scale apps that are available, and are they effective?
You know what? That's a great question. I haven't used them personally. I have recommended them, but now that someone has asked, I'm going to add it on my to-do list to make sure that I check them out a little bit more closely. But if it is the app that is from the website itself, then I would say yes, helpful because it is from the actual developers that they will have all the right information on there. As far as how helpful it is for storing any information or tracking things, I'm not sure, but it will be a good resource to have all the information in one spot.
Great, thank you.
You're welcome. Okay, sorry. So the beep chronic scale, there's one that's for cats and one that's for dogs. And then kind of gives some recommendations as you're going through things for when they would recommend veterinary intervention. And then we're going over 8 different parameters that start with the letter B, E, A, or P, hence the name beep pain scale. Um, okay, so I would recommend these are done as often as the quality of life scales are done. But the way that I recommend them to be done is that if we actually start kind of at the bottom and look at each of the parameters before being too influenced by the different things that are up here. So for breathing, if you're saying, oh, my pet is panting, then we're going to go look and see, okay, panting somewhat, panting often, where are we going to kind of check off things? And then I like this too, because there's some of these things that none of this has to be really medical. These are all observations that we can make at home. Um, excuse me. Sorry about that. So the things like eyes, so we're looking at tension. I'm not asking about, do you see cataracts? Do you see conjunctivitis? No, we're asking specifically things like, are they looking dull or worried? Do they ever look panicked, having tension, that sort of thing? We talk about their movement. Um, their activity levels. So things like, are they interacting? Are they hiding? Again, touching base on that appetite and thirst. We're also looking at their posture. So that's where these images come into hand, that we have a real nice kind of visual of showing like which of these does your pet look like, um, has an indication, and palpation, touch, those sorts of things. So there isn't one specific thing that will say your pet is in pain, but kind of if we look at all these different things together, it can be very helpful. And then once we've kind of checked everything off, and I believe this form that you can get off the Blue Pearl website, you can actually click into here. It's an interactive PDF. And then it will show you, do you need to speak with your vet at your next visit? Do you need to go there right away? I'm so sorry about that. Or are things really concerning and you need to go right now? Sorry about that, everyone. Okay, so some of my final thoughts here. This tickle my throat won't go away. But of course, quality of life and pain in animals. Sorry, quality of life and pain in animals is extremely important for their welfare. And as humans, whether we are veterinarians in the welfare field or their caregivers, we are their advocates. So we can help determine how they're feeling and their pain levels with these different scales. And we can also share these. So we can use the information that we have learned today or already know to be able to teach others and show them that there are different resources that we can use to assess pain and quality of life in animals. And again, I'll just show my contact information in case you need to get a hold of me.
Well, we give Dr. Liz a minute to get that rid of that tickle. It just won't go away. I know what it's like. Allergy season for me right now is the worst. But we do have some time for questions. So we do invite you to pop your questions into the chat or to use the Q&A feature, and we can get those questions to Dr. Liz. Dr. Liz, if you think you're ready, we do have a question that has come in, but
Yeah.
if you need a second, that's cool too.
Yeah, I'm also going to put this up just while we're chatting so you can
Cool.
take a screenshot of it if needed. Sorry, guys. I guess I'm
Awesome.
talking too much that it's.
So the question here,
Mhm.
the person has a comment and then they ask a question. They say, I've always felt that helping people understand that being there for their companion animals in the end is the best or most important thing we can do for them. Do you have any insight on how best to express that to people who are perhaps struggling with that?
I think this might be one of those things where I suggest coming from a non-judgmental lens, especially not knowing what that person's past experience has been with death. There may be a really valid reason why they don't want to be present. Again, based on what I do, you can probably guess that I do really think it's important to be present with our pets as they're passing, but I do let people know that even though I'm in their house, that if they need to step out or step away, that they can do so, that I'm not there to force them to be part of everything. But I think, excuse me, if we can show them or just let them know that pets tend to be less stressed when there's a familiar person with them, that would probably be the biggest thing I would share. But to try to not take on too much if somebody says they do not want to be present.
Yeah, that would be well, I think we all can recognize how difficult a situation it is, especially when you have to make that choice. So, um, being in the room when it happens, I have fortunately not had to go through that process yet. But as somebody with an older pet, I know that that will that's what's in my future, and yeah, I can see how it would be a difficult decision for folks for sure. We don't have any other questions that have come in at the moment. There are some comments in
Mhm.
the chat that you might want to check out. They're Dr. Liz, as Sydney has some comments for you.
Thanks, Sydney.
Um, and Call Out Wheeler says, even as a vet, it's difficult to be objective about their one's pets. So the scoring charts are a useful way to be objective. It's always heartbreaking. Yeah, absolutely. I have a best friend who just this past week had to make the decision to put their dog down after his kidneys failed, and it was a situation where they really struggled, and they're still struggling today because their dog was. They don't have any children, and this dog, I think, filled that role.
We're
Um,
a family. Yeah.
and yeah, it was tough, and it's again, as a pet owner, it's a decision I think we'll all have to face at some point, but it's not going to be easy, even if we know it's coming.
Yeah. And that's something I share with a lot of families I help as well. So as I've mentioned that we lost Jack in the winter, and it was one of those situations where I thought, I'm a vet. I only work with pets at the end of their lives. I should know when it is time. And I still struggled as the vet that should know, right? So to take that, excuse me, to take that off of ourselves, that we're putting a lot of pressure that we should know. And if someone that has all the resources still doesn't know, that you shouldn't expect yourselves to know the exact time, and to know that the vet team is there to help you, so that you're not on your own, just as Dr. Wheeler mentioned there too, that being able to have other resources to rely on is certainly helpful.